Welcome to the InfoSec Insider podcast, brought to you by URM, the UK's leading information and cybersecurity specialists.
Hi, my name's Annie and I'm here today with Stuart Moran, who's one of our senior consultants here at URM. Welcome to another episode of InfoSec Insider. So today Stuart and I are going to be talking about ISO 13485, which is the international standard for medical devices quality management. So just to start us off, Stuart, I'm going to ask you a very broad, big question. What is ISO 13485 and why is it important for regulatory compliance?
As you said, Annie, ISO 13485 is an international standard for medical devices quality management systems. It includes in its title requirements for regulatory purposes. And I think that's the most important part with this. It is a very specific standard pointing at medical device regulatory compliance, and it includes requirements that are specific to, in its latest form, the European medical device regulations, and in its other version, the UK medical device directives are explicitly called out in the standard. And it provides a medical device quality management system framework by which medical device providers and service providers can evidence compliance to the relevant parts of the regulations.
So if an organisation is a supplier to a medical device manufacturer, why would ISO 13485 be applicable to them?
Well, although they might not be direct medical device providers, the medical device regulatory supply chain is quite heavily regulated in itself, and critical suppliers to medical device manufacturers may be required, depending on what they're providing, to be 13485 certified in their own right. And if they're not 13485 certified and the medical device is under a regulatory assessment, then they may get assessed by the manufacturer's certification body to ensure that they have adequate systems in place, which all sounds very confusing. But it basically, 13485 would then provide you with evidence that you have a suitable management system in place to provide safe device components or software components for the primary medical device.
So another scenario for you here, Stuart. If an organisation is selling its devices into the UK and EU markets and it's currently marketing a Class 1 self-certified device, why should they look at ISO 13485 implementation and certification?
Again, there are regulatory requirements applied to a Class 1 device, and part of that regulatory requirement is to have a quality management system. The easiest way for them to evidence they have an adequate quality management system in place and the underlying documentation that's required by a medical device is to implement and maintain an ISO 13485 medical device quality management system.
And when should organisations think about implementing 13485?
I always feel this is a little bit of a flippant response, but as early as possible. When an organisation is considering that a device or something that they manufacture or an idea they've had may be a medical device, they should then consider 13485 alongside its regulatory compliance so that they're building those processes in from the very earliest stage. I have some experience with organisations who try and backfit 13485 after they've tried to go to market with a regulated device, and there's always an element of rework and reframing their management system to make it fit 13485. Whereas if you start with the front end, it helps provide the framework in which you can build your medical device management system. I hope that made sense.
No, that does. It's easier to do it early on than retrofit 14. Yeah, no.
Yeah, the same with any standard, really. Yeah,
exactly. So why doesn't ISO 13485 look like other ISO management system standards that our listeners may have implemented?
So when ISO decided to make the move to the Annex SL standards, which are the modern versions of 9001, 27001, 14001, which is the environmental management system. They created a standard ORS framework with standard language in it. Because 13485, as we've already mentioned, is requirements for regulatory purposes, it aligns more with the requirements of the old EU Medical Device Directive, which is now used by the UK, and the EU Medical Device Regulation that was issued in 2017. So it's aligned and joined up with the regulation. Therefore, it's been left in the old ISO 9000 format, which is clauses 4 through 8 rather than clauses 4 through 10. But it contains the same information, just in a different order.
I know if you implement, say, ISO 27001 and ISO 9001, you can integrate those two management systems. Can organisations align and integrate their ISO standards documentation and activities with the requirements of ISO 13485?
Simple answer is yes. As I mentioned in the last answer, although it's in a different order and different numbering sequence, a lot of the requirements are the same. So you still have to do internal audits, you still have to do management reviews, you still have to have document control and records control. So a lot of the stuff is the same requirement. So if you've got a document control procedure, don't rewrite it because you're implementing 13485. Just make sure that any additional requirements for things like medical device files are included in your global document control procedure. Same with internal audits. Don't go and audit things twice when you can audit them once because it's the same thing. So yeah, and we work with a number of clients where we're supporting integration with 9001, 27001, their service management standards compliance. So yeah, it is absolutely achievable, and by integrating, you're saving time and money.
Absolutely. And that's a really important thing, isn't it? It's making it easier for yourself. So a bit more of a topical one now, Stuart. Will the current very significant changes in the US federal agencies impact the FDA's move to align their regulation with ISO 13485?
We've had a look at some of the main news feeds on this, and we can't see that the decision that was made in February last year, or announced in February last year, to align the FDA 21 CFR 820 requirements with 13485 has changed. They put a lot of work into it over the years, and from a global perspective, it assists American or US-based medical device manufacturers to access global markets more easily because their system is aligned to 13485, which is the global standard. So, my personal opinion is that I suspect it won't change, and they will go ahead with rolling it out by 2026. But it's watch this space.
Absolutely. Thank you so much for your time today, Stuart. And for any of our listeners that want to learn a bit more about ISO 13485, Stuart's written an excellent blog that's on our website, urmconsulting.com, and that is called ISO 13485 Medical Devices Quality Management System Explained. So do go and check that out, and thank you for listening today. If you've enjoyed this podcast, we would really appreciate it if you could spare a moment to leave a rating or review at ratethispodcast.com/InfoSec Insider. To listen to more episodes, you can find us on Spotify, Apple Podcasts, YouTube, and Podbean.
Thank you for listening to URM's InfoSec Insider podcast. For more information, visit our website at urmconsulting.com.